Hi, and welcome to the Economic and Community Development Meeting. I'm Sandra Clear, District 2.
Michelle de la Isla, District 5.
And we need to approve the minutes.
I will make that motion.
I'll second. All those in favor? Raise your hands. Okay, and they're approved. I would like to change number 4. Let's move that up under number 2. Let's make that number 3 and number 3, number 4. So we can talk, because the purpose of that is to discuss, since we can't, outside of an open meeting, we can't discuss with each other what's happened. So this is to discuss the feedback that was received at the last meeting. And I think the one thing I heard was about board diversity. And I had a question about that when I first got on the committee, is why an agency should be penalized for not having a diverse board if within that agency and their board and their procedures and their rules, it's not important, but maybe not required. Why is the city requiring that when they may not have to require that within their own agency?
Well, I think that the impetus behind this is the fact that we are a city that wants to ensure that every single person that receives services is represented in the board.
But how can we make them do that?
It's a regular practice at the federal government, in different organizations, that we try to make sure that the organizations that are receiving funding are looking and trying to do a best effort to represent the community that they serve.
So why do we ding them if they're unable? Because there was a couple, and I have heard from 2 actually, they are just unable to do that. Not that they don't want to, but then I can't remember who it was, but they don't even pick their board. It's picked for them. Mm-hmm. So I'm not sure if we should be dinging them for not being able to provide that diversity.
And from my perspective, diversity and inclusion is extremely important, especially when we're working with individuals from our community. We want to make sure that our community is represented from every aspect.
But what if they can't?
Think that, well, then in my estimation, what we would do is this is a good way to show to stakeholders and to show to the board the importance that we place in the community with regards to making sure that we are well represented.
Mm-hmm. So even if they're unable to, you still hold them accountable.
It just gives them the opportunity to have that conversation at the time that they're selecting for new board members.
But there's somebody that doesn't select. I can't remember who that was. They're just actually, here's your board, and they assign the board members so they have no control over. I don't think that's fair. That's like me, saying I have no control over, I don't know, driving a certain car or whatever. But you're gonna hold me accountable for that, and I don't have any control over that. I may agree to disagree. Have Tony be the
tiebreaker.
That's right. Okay. So did you have any, because you weren't here, did you see anything in here you want to discuss? It was just so we could talk about, most things were positive.
Mm-hmm. Seems that most organizations are pretty content with the scoring process. There's requests for information on the funding allocation, how we're doing it a little bit better. But overall, the comments are positive. The only areas of concern that I'm seeing here is the making the $25,000 maximum so that we have more money to spread through the organizations.
But we haven't got that far yet. Just on it.
My bad.
So is there anything else you want to talk about last meeting?
No, last meeting, no.
Okay. Now, we're on the funding formula. Okay. So this was, after several meetings, the reason that we even looked at this was to get the people that got stuck in 2016, right, not 15, 16, to get unstuck, because some changes were made in 16 and it stuck some agencies. And so they could never get more. They were stuck. And to level the playing field. Somewhere along the line, some agencies became more important than other agencies. And so this kind of levels that playing field. So these were the changes we were looking at. Accept applications for new programs with the knowledge that only if there's funding left will they be funded. So not all new programs just automatically going to get funded like they have. And then each agency can apply for the $25,000 max if the council approves the funding for the $25,000 max. Applications be scored, and the percentage of their scores would be multiplied by the amount requested and their score. So they still have to go the scoring. Scoring would still be valid. So if they requested 25,000, they got a 95% score, they get the 2375. Okay. Do we want to discuss?
So my concern would be, with regards to that, there's organizations that I know that receive a lot more funding than the $25,000. And one of the things that we had been talking at the city council level was more than going ahead and reducing the amount of funds, making sure that we were really purposeful with regards to how we were going to allocate those funds in the future to ensure that organizations that are providing critical services that are very needed in the Topeka community were able to receive adequate funding, which would further maybe reduce the amount of organizations that could apply for those grants for that year, because they would be targeted towards the areas of concern that the city has
Which we've set our
identified.
priorities. So that's what we should be looking at. So all these agencies hit those priorities. Now, how can we say this priority is more important than this priority if we have priorities? They should be all the same. I mean, who's to say, okay, social services, youth, I'm sorry, you're not as important as CASA. You just don't get as much money. Not when we've already set the priorities. Why set priorities then? Or if you're going to do that, you're going to need to say, oh, this priority has more value than this priority. And I'm not sure we want to do that. I think that would cause a split.
Well, the concern that I have with regards to that is that I think, for example, of the two big items that I keep on hearing in the community of public safety and health, and public health and access to proper health care. So when I think of organizations that are providing those key critical needs to the community, the discussions at the council level, even though there was no voting for it, was that maybe we should take a look at what are the really crucial things that are coming at us and how we could better allocate those funds into organizations that are providing those specific services. I know that, again, there was a lot of talk about mental health, support for some things that are supporting public safety, but the council never voted on it. There was discussion at the time of the budget with regards to those issues, and it was how to really go ahead and target those funds so that, contracted services aside, you have these funds that are granted out into the community so that we could really go ahead and support.
But I don't think we can do that with our priorities set.
Okay.
Let's go to the contracted services. So if we, for some reason, these services got in this grant funding, which aren't grant funded, they're contracts. So why do we not move Safe Streets to TPD with the money? They just go over there because they're a contract. They're not a grant. Right?
Okay.
Move housing to neighborhood relations. JAAA would move to the social services because a grant, because they need the grant. Center for Safety Empowerment would be a grant. KCSL, which TPD has to have, they have to have that service, would move to TPD. Because these are services they have to have.
You see, and I disagree with the Center for Safety and Empowerment, because that is a crucial service for public safety in our community. They're the only organization that are able to keep victims
Well,
safe.
then if TPD agrees and they want to contract with them and not have it be a process, a grant process, they can do that. Move them to TPD if TPD is the one that has to have them. But why, if they're a contractor, are they in the grant process? When they don't really do the grant process, they're a contract.
Well, the impetus for us to go ahead and do that is because there was not a public review to these organizations, aside from working directly for the department. And the thought at that time, and staff, please help me with some history if I'm wrong, was that this was a great opportunity for us to be able to provide oversight, to ensure that they were accomplishing their goals, to make sure that they were not only submitting the quarterly reports that they're supposed to be receiving with staff, but that it would also allow us an opportunity to take a look at them, ensure that they're still doing the same job that they agreed that they were going to do, and that they were still a priority for the city.
Then why do we only do that with these contracts, not every other contract the city has?
Because these do public, social service related issues.
And there's no other social service related issues that has a contract? Are these them? Do you know?
No, it's not all of them.
Just
Not all of them?
The contract for, what used to be called Water Share
Mhm.
program is a direct contract between finance and CRC. That's one that can be
Well, and I don't know if,
done. And we,
no, go
we
ahead.
also contract with HCCI
Mhm.
separately from this process. It's less of a social service, but it is financial and homeownership counseling. for
Total.
program.
Mhm.
So those are, that's a little less of a social service.
It bothers me too. If Safe Streets was at TPD and they moved over here
Mhm.
for us to be able to monitor how they're doing, why was that? Why isn't TPT able to keep their own contracts in check? Why is the staff? Because TPD knows, they know what they're supposed to be doing. They're the ones that should be monitoring this. Why is other staff doing that when they really don't have any connection with them?
The concern that I personally have with making these moves right now is that us going ahead and making these moves without contacting those departments and having conversations with them,
No, I think that's been done.
but that's been done.
Has it been done?
I talked to the city manager about the two that we were discussing moving directly to TPD, and he was going to
Yeah.
handle that, and I think you spoke to him.
I spoke to him too.
So my question then to staff would be, if we have clarification from staff and from the departments that we're going to safeguard the current allocations and that they are committed to maintaining those contracts, then, I would be okay with that, because we're not just giving the department something without having communication with them.
Could we leave it in the framework of quarterly reports and outputs and outcomes
Right.
that ECD could be privy to?
Yes.
That way we could still monitor that and help ensure for the community that they're meeting specific goals, but it does, and I've said this since I became involved with this group, it doesn't make sense that we have contracts in this process. But I understand what you are saying about needing transparency on the outcomes. And I don't know why we couldn't.
And again, I'm happy to make the transfers. However, I do want to ensure that we have KCSL and the Center for Safety and Empowerment pass through with that funding back to those departments, that we could go ahead and ensure that they are allocating those funds, and that they could work directly with those departments to ensure that those funds are available for those two organizations.
I can't speak for TPD, of course, but the two that we're discussing,
Why would the Center for Safety Empowerment not be a competitive process? Why would we only contract with them when there might be agencies out there that could provide that service?
It's an unduplicated service.
Doesn't mean it would be if it was opened up to a grant process. The only reason it may not be now is because there's a contract for it. See what I'm saying? Because I can think of one agency that may say, yeah, we can provide that service, but there's already a contract for it. But, and so what? Even if they do come to the grant process, they would get it, wouldn't they?
I think we have a difference in opinion with regards to the role that they're having in the community. I know for a fact that the YWCA is the only organization in town that is equipped to provide the services in the city of Topeka, because it's not just about housing the victims of domestic violence, but it's also providing the training and the support. And they are the only place in the city that are providing those key critical services, so that TPD then could go ahead and have interactions with these victims and they could receive additional services.
So would they move to TPD, or do you see a reason why they would,
I believe they should be in
Okay.
TPD.
and not be in the grant process? Okay. And then JAA would be competitive, and Neighborhood Relations, HCCI. Okay? All right, so let's move back to the funding. So if we move all those people for the formula for the 25,000, what did it come up to for going to council? What amount?
Last year for contracted services?
No, if it was all 25,000. If we took out the contracted services,
Oh,
I think I have that somewhere. I think there's 25 agencies, or 27 times 25 would be what? Because it's,
That would be 675,000.
Yeah.
The total for 2018 was, if you subtract the contracted services, was about 408,000, I believe.
but then we decided not everybody's going to get 100%, because look at last year, right? And it's not, and what else did we talk about? That it probably wouldn't come to that.
Corey or Sasha might be able to shed a little bit more light on this, but if we did it at 25,000 times their score, we would just kind of rank them by score, and then once we hit the threshold for whatever
That was-
council,
That was the discussion.
whatever council said that final amount was, then those that were, ranked lower would not get the funding.
Which is what we did this year anyway. Same thing. It's just asking for more money.
My only concern is, we have been providing, in some of these organizations, an amount of clientele that we have been able to serve, and then if we limit that to only 25,000, what we really are doing is that we're really cutting the amount of services that we're providing in the community, just so that we could allow other organizations to receive funding.
No, to allow other organizations to up their level of service. Why should representative or agency A be able to give 100,000 people, but B can only give 100 people because they don't get as much funding? But if they did, they could do 1,000 people. You know, why are we saying this agency is so much more important? And I don't understand, and we had talked about, for some reason, okay, so we have these agencies that have been around since, well, this goes back to 13, and then some new agency pops in and gets more money than they ever have gotten, when they could have used that money, just like this agency could have used that money. So I think that was a glitch back in 16 when that happened. I don't think that was thought through very well. Because they come in, cut all these people, but they come in and get, I don't know, after looking at other grants, other cities, a lot of cities do this. They have the amount, this is what you can get. If you score high enough, that's what you'll get.
I just think the 20, and here goes back to the argument of how small of a grant are we going to provide to the point that it's only going to give as much as it's worth to almost write and manage the grant. Because I remember just being in the process of being a grant writer myself and having to invest hours upon hours upon hours to write the grant, to monitor the grant, to do the quarterly reporting for the grant. So therefore, when you minimize the amount of funding that we're giving out into the community, we're really going ahead and minimizing the amount of real service, because as a grant writer, I can tell you that it takes forever to manage and write these grants.
Yeah, but 95% of these people will get more money. They're not asking, what they get now and what the 25,000 will be more for everyone except 2 people.
Which the notes say that the max is 25,000.
Right.
So, I mean, I'm not saying that everyone wouldn't apply for 25,000, but I think it's not that what we discussed with Nick and Corey and Councilmember Clear and myself was that we would just cap the max amount.
So they could get, I mean, these people that asked for 7 and 10, and I mean, they could get 7 and 10. But I think the max requested, most of them are under 25. So actually, we're doing a lot of people a favor, except for the 2. And why they get more, why they're considered more important, I don't know.
I'm so sorry.
Well, that's not, I've written all over that so much, you can't hardly read it.
Here, I have one of those, but it doesn't have writing on it, please.
I have an extra one. I got one.
I think there are 3 agencies that get 20, well, one of them, I think First T gets 26.
Yeah, and they just came in, I don't know why they got so much to start with. But, and I really don't, I don't look at these organizations, I'm looking at the money. Because I think all the organizations are all equal. I think they're all important.
Positive Connections, it's Positive
Yeah.
Connections, Shawnee County Medical Society, and then First T. The rest of the programs are,
Which one is only $1,000 off? The other's 10,000 and 20,000. See, that's crazy to me. Why did they ever get $20,000 more than anybody else anyway?
Well, I think that if you look at the organization that we're discussing, is an organization that deals with individuals that don't have health care. And we are providing and ensuring that our citizens with the most vulnerability have access to medication.
So, yeah, but we have Marion Clinic, we have,
Marion Clinic was closed.
yeah, we didn't fund
they didn't
them.
request funding after 15.
So we have the
So you're
only,
saying that's more important than Community Action, Breakthrough House, Kansas Legal Service? What about these legal, they need legal. I don't understand that.
and I understand that, but if we don't have healthy citizens that are able to go ahead and take care of their medical needs, they won't be able to research and access all of the other services. So I think that maybe because I have an understanding of the crisis that we have in our community with regards to the lack of affordable health care, with the loss of individuals in our community not having proper support, which also piggybacks into public safety, Because when we have individuals that are receiving their psych meds, for example, from this organization, when we are saying at the council level that we are needing to be more supportive of public safety, it's of great concern to me that the one organization that does provide those medications, that does provide that dental care, that does provide direct medical care, life-saving care to individuals, that we're going to go ahead and we're just going to say arbitrarily, I'm just going to cut that amount.
Well, then
Because it's one of the few organizations that has consistently given us high scores.
Then we should change our funding priorities.
And that's,
But we've already set them. It was voted on last time. So, I mean, unless we're going to say our medical needs in the community is more important than aging, at-risk youth, emergency housing. I mean, I think housing's just as important as
oh,
mental
no, yeah,
health.
all of them are.
And exactly, they're all important. So I don't know how you can rank one higher. We've only got in so much money, and I think to be fair, you divvy that money up, because just because that's somebody's need, I mean, 1,000, 1,500 people's needs. Look at the Boys and Girls Club. They serve 2,000 kids. Okay, which is more important? I mean, the Latino development, I mean, I've heard from those people. I just can't say, yes, yes, it's important, but, and why is it Shawnee County and the city gives them funding? I don't get that either. Why is it Shawnee County Medical Society?
Because we're dealing with the lives of people and their health of
Yeah,
our
but it's Shawnee
community.
County. I mean, does Shawnee County fund them too?
I don't know. Yes, they do.
The same amount or more?
I think. Could we ask the executive director to speak?
The county also funds prescriptions for health access, both the city and the county.
The same amount?
Were at the table when the program started. They jointly agreed back in 2002 to fund $125,000 a year for prescriptions. I'm Carla Nyquist, Executive Director of the Medical Society Health Access Program. The Shawnee County Medical Society is actually a program of the Kansas Medical Society. We are a program of Shawnee County. We just happen to be the organization of physicians here in Shawnee County. The county and the city were at the table when this model of charity care was brought to Topeka in 2002. It's a best practice model from Buncombe County, North Carolina. And it spreads the charity care amongst all of the physicians and hospitals in Topeka that are donating, over 300 physicians. And the important piece of that is prescriptions, because it doesn't do any good for the hospitals to donate and the physicians to donate if the patients can't get their prescriptions and get well. So that's why the city and the county were approached back then to be part of the initiative. And at that point, the city and county equally funded us at $125,000 each for prescriptions. The city and the county both have seats at our Management Oversight Committee and have continued to help us guide the program. We really are a community collaborative for low-income uninsured. We're trying to make the safety net more efficient for both the hospitals and the patients. Over the years, the funding from the city has decreased, obviously, to the amount that we are at now. And it wasn't based on income, or on outcomes. It was based on city cuts to social services over that period of time. This year, we're receiving $105,000 from this county.
Okay, thank you. So how many new agencies came in after 2002? One, 10?
I have no idea. Been here 3 years.
See, and I think,
I mean, we can go back as far as.
because I just, my point is, it's changed. I mean, yep, in 2002, that might have been the best deal, but if we've had 15 new agencies since 2002, we aren't able to do that any longer. I mean, if we're going to say the other agencies are just as important.
If there were to be a reduction in amount funded, I still think that $25,000 is too little.
Yeah, but look at how much that's asking the council for 200,000 more than.
And the deal is that we know that these organizations will more than likely not have 100%. So I think that the onus on us is to ensure that we are grading those organizations so that, like, I love the formula thing, because we had talked about that when we started this process. If you have 100%, you get 100% of what you get. If you get an 80%, you get an 80% of what you requested. At which point that if your multiplier is less than $10,000, which is our minimum, then you don't get money. Because that way we're not wasting your time on writing the grant, and then we're not wasting our staff administrative time on managing a $10,000 grant. So I still feel like that $25,000 is extremely small of an amount for an organization to apply for.
But that's what they've applied for many years.
Amount requested, I'm seeing more or less an average of $40,000.
Oh, yeah, but they requested, they jumped up their request. That's not even close to what they're getting. So go to what they're approved is all within the 25,000. I mean, so whether they requested 40 or 500 or 10, it was already set what they were getting. That's why we're doing this. They were already set to only get this amount of money, and they're all under 25,000 except 3. Can you say it any other way? Am I missing anything?
I don't think so. There are only 3 agencies that received more than $25,000 for 2018.
And it's not because maybe they didn't need it, it's because that's all we could, it was already set for that amount of money.
But I think that we're going back into looking at all of the organizations and saying, because you're all in the pot, I want to make sure that you all have access to $40,000. And I think that the whole process of what's going ahead and having a structured method of evaluating the grants was that, so regardless of who's out there requesting the funds, we have a pot of funds that is competitive so that the best grants are able to come in and receive those funds.
So the people that got stuck, because there was a decrease in 16, how do you make that up to them? They never should have been stuck. That was an oversight. That happened and it shouldn't have happened. So how are we going to correct what shouldn't have happened in 16 for those agencies that now can never get more funding?
What happened in 16, if you look at the 2016 requested column, is that many of the requested amounts jumped significantly.
Correct.
And as a result, I mean, there's a limited amount of funding. So there was no way that we could fund all of those with
Right.
the dramatic increase in the amount requested.
So you went off the 15,
We did. because
and then it stayed, and then you went off the 16, and then you went off the, so they always stay there. So this just,
Yes.
right, so this would level them. Instead of staying there, they can now go up to 25. Unless you have another, what is your solution to that then? Because we met 3 or 4 times, can come up with another solution to level the playing field and get those certain agencies unstuck from 16.
Since there's only one organization that is receiving that extra amount, would it be possible for us to allocate that organization aside and then bring that discussion to the body of the council? Because it seems like that organization has a seat from the council serving in it. And it started that, so I'm just
Okay, but you're
asking.
telling all these other agencies, sorry, this agency's more important, they're going to get more money.
I'm-
I guess we could have that discussion. I mean, we could. Okay,
Or could we
like it's all
raise-
25,000.
Or
except-
could we raise the amount from 25,000 to something more? I still feel like $25,000 is too small of an amount for an organization to write a grant that has to be supported on a quarterly basis. And then we allow all of the organizations to make a case that they're going to provide more services that they provided the first year, to see if they can show that they're going to be able to meet that.
We chose 25 because that's what they mainly, well, that's what we can afford. I mean, that's even a little more than what we can afford. But it was also what they had been funded for many years.
So, right, we averaged the totals
averaged.
on requests and then averaged what they received in funding, and that is where that 25,000 shook out.
I think the only thing I would say is that if you raise it to 40, the risk of doing that is that there are fewer organizations that would get funded, assuming everyone, which maybe they wouldn't. I mean, maybe some would stay at their current funding level, but if everyone raises it up to 40,000, then that cutoff point is much higher, and so with the 400,000, you would fund probably 11 or 12 organizations at the 40,000, whereas at the $25,000 level, you would get closer to what it is right now, which is about, I think, 27 organizations total. But I mean, ultimately, from a finance standpoint, it's just that finite amount of money that we have, that the city is allowed to appropriate to social services grants. So that's
So you've
that's-
done more
that's-
with the 25.
that's just
Yeah,
kind of
because the pot is-
a risk, but.
It's smaller for people to ask from.
We vetted this a lot of different ways.
Could I ask the organization a question? Is there any funding that is going to administrative services, or is the funding that the city is providing going directly into medications for the community?
Sorry, that way it gets picked up on the audio.
Of the 53,000 that we're receiving this year, 3,750 goes to help administer the prescription program. The rest goes directly to prescriptions.
Thank you.
Where else can you get help with prescription costs? I mean, is it the health department, or is this the health department? Is different? Health department's different? Can't you go there and get prescription?
Could we?
Health Access assists low-income uninsured, and so there are people who make less than 150% of federal poverty, live here in Shawnee County, and don't have any other kind of health coverage. They can receive emergency prescription assistance from Let's Help, Doorstep, agencies that do that kind of thing. I believe it's a one-time thing, or it's limited. They often do that to even help pay the copay for the prescriptions that we help them with. But it's emergency get in, get out. Our patients are enrolled for a 6-month period, and we're trying to help them with preventive care to keep them out of the emergency room. And to help them maintain their health so that they can work and stay productive and pay their taxes. And
So they could, what's the health department offer?
the Shawnee County Health Agency, or Health Department, now has a prescription. There's two entities. There's the Shawnee County Health Department, which offers a prescription assistance card that's like a discount card, like the same thing you could get at Walgreens or United Way or any place else. Grace Med took over the community health center, and they don't offer prescription assistance. They're low-income, uninsured, are enrolled in Health Access so that we can help them with that.
The only problem.
I got an idea. Why can't this be a contracted service
Yes.
with somebody?
Yes. But the problem is where?
I don't know. Where?
And that's what I'm thinking
department-
too,
But
is
what
which
department in the
department?
city would want to the contract for healthcare?
It's not a contracted service.
It's not a contracted
Because-
service.
Because, well, look at our definition of contracted service. What is it?
Contracted services are services the city would have to pay for or provide if the agency did not do them. And even though it's extremely valuable, I would say that's still not a
It's
contracted
not a contracted
Right.
service.
So they're not essential to city operation.
But they're essential to the community, and that's the concern. I mean, if
So
you
is
want to talk,
everybody else? We just might have. Well, I'm glad you're on that side. I mean, really, we
No,
need
no.
both sides.
no, we do, and we do, and it's not that I don't feel like all these other organizations are not important. They're absolutely important, but at the same time, when we're talking about a crisis in mental health, we're talking about a crisis statewide with regard to the loss of insurance of many families, when we're not knowing if people are going to get services for physical care, then all other care is going to fail, because a sick child that doesn't have his ADHD medication will not be able to sit through
Well-
class and will not be successful in the Boys and Girls Club. And the mom that is not well enough to take her child somewhere. So it's just, to me, especially with everything that we have going on, health is a fundamental thing that, as a city, is one of the few places that we could actually step up and say, this is a crucial priority for us.
But they say they funded, or was it 1,000, 1,500 people? What was it?
That is our average enrollment per month. Right now, we're closer to 1,600 enrolled, and so my grant goal is that's how many we would.
How many of those are different people? How many different people are there?
Since the program began in 2002, we have served 14,000 distinct individuals.
So how many is that per year?
Just saying.
So 14,000 divided by how many years is that?
15 years.
1,000 a year.
But that's not the case, because we currently have 1,600 enrolled, because somebody who needed us in 2002 and needed us again in 2006 and needed us again now is counted as one individual in our database. So when I say we have 1,600, those are distinct individuals who are receiving care right now. They're only enrolled for 6 months, so they come and go all the time.
And what's the cutoff? What's the poverty line? Or like what's the income?
150% of federal poverty is, I think,
No, I mean, like, what is your guideline? Could I come in and get help?
no, it's
Okay, what-
150% of federal poverty is our cutoff, and it's about 1,505, or so I could get my notes, per month gross
How
for a
much?
household of
15?
one. 1,500. And so if you're paying rent and you're paying utilities and all of those kind of things, a $700 insurance premium is not in your budget.
Yeah, but your population's really small then. I mean, because you're going to hit these people. I mean, I can't afford it either, but I don't qualify for your assistance.
There are approximately 17% of Shawnee County citizens are uninsured. And so
Right.
that's who we're looking at. It's the uninsured that don't qualify for a medical card because they make too much. They're the working poor. They don't make enough to qualify for the Affordable Care Act subsidy. So they're those folks right down the middle that don't have other resources.
Right, but there's still, who's taking care of the people above?
the people that make too
In the
much,
Affordable
they
Care
can
Act.
apply for the Affordable Care Act and receive a subsidy on their insurance
Well-
premium for a few more months, maybe.
Yeah,
You know,
and that
that's
didn't
gonna-
work for some people.
and
I know.
that will
They're-
mean-
They're in between you and them.
Right, that will
There's a
mean that we'll
gap.
see.
There's a gap.
That
Between
will mean-
Affordable Care and Medicare.
Yeah, and that's who we serve, is those folks right in between Medicaid and Affordable Care Act. And if the Affordable Care Act has changes, we will see increases in numbers who are uninsured.
Well, I'm thinking about the people that make $2,000. But by the time even if they get the Affordable Care Act,
Then they have a subsidy that helps pay that premium
right,
through the
but
federal
they still don't
government.
have enough, and it still doesn't cover prescriptions sometimes. I'm just saying, there's still a gap that nobody's helping up here.
I'm-
So I'm saying, you've got this group down here.
The
I'm
bu-
just saying,
yeah.
there's still these people in our community that's not getting, there's still people left over.
Oh, my mom, has Medicare when she hits her donut hole. I mean, there's, none of us like or,
Right.
feel like we can afford all of the medical costs. It's out of control. But we have to limit it to the folks that are the most needy, that don't qualify for anything else, or for people who have nothing. So, some people have insurance and still don't find their premiums affordable, but these are people that have nothing.
And I agree, because I've been there. But I still think we could have each one of these agencies come up and say why their agency is important and how they help. I mean, I think every one of these other people could do the same thing.
And I want to say for the record, I agree, and I don't like being singled out as more important, as an agency, because we work closely with all of these other agencies. This was a commitment that the city made long ago. It's not a contract. It was just a belief in the initiative that we were bringing to Shawnee County to try to help spread the charity care amongst everyone. So we really are a community collaborative. Both hospitals donate, over 300 physicians donate. Blue Cross and Blue Shield donates claims processing. Pharmacies don't charge us a dispensing fee. They've all agreed to maximum allowable cost pricing. The list goes on. We work very closely with Grace Med, just like we all work together.
So they said health access, and where was the other medical? Doorstep? What's their medical services?
Emergency assistance. And, for people that have that one time, I can't afford my medicine today.
Okay. So what's your solution? Because this is the best this is what we came up with.
It's just concerning to me that all of these organizations, except for this one particular, was a
Well,
collaborative
actually, two,
started by the city of Topeka with the county to ensure that we provided this service. So the city saw a value in this program specifically to start it with the county in conjunction to the county.
And none of these other
And all of these
agencies, none
other,
of the
except for our
aging-
contracted services, were organizations that we're opening up a grant pool for. We decided that we as a city wanted to ensure support for healthcare and for critical need medications for families in our city.
But we also decided that these were priorities also.
Correct, as a grant process opened up.
Right.
So the city never said, hey, by the way, we believe in your organization so much that we're going to allocate so much funds to you. It was, here's the grant process, come and qualify for it and apply for these funds, and we'll see, how you rank. So that's my only concern, that it's not that the organizations are not more important. It's
Well-
just that as a city, we made a conscious decision that we were going to partner with this program versus all the other organizations are organizations that have applied through a grant pool.
And this was in 2002. I'd like to see the history between, maybe we had more money then, maybe there's only 3 agencies then, and now there's 27. I'd like to see what that was in 2002 then. But I don't know if it really makes a difference where I stand, because I just think they're all...
And I understand that.
And I
mean,
understand you too, so what are we going to do? I mean, we could make the cap of 25,000. Now, tell me if we can do this. Make the cap of 25,000, vote on that, take this organization, talk about it in the council on where they might fit into the grant process. But as far as everybody else, it would be the cap of the 25,000. Each agency could apply for 25 max. We had discussed, what if there's money left over? Okay, so say we get the $675,000 from council. What if there's $75,000 left because everybody didn't make the 100, and what are we going to do with that money? It was discussed either give it back or divvy it up.
That's what we've done
in the past since
Yeah,
I've
we've
been
given it
here. It's
back
gone
or divvy it
to
up.
general.
Or divvy it up. So this may not really be an issue, actually, because if we had, what would the average, do you think, would be following what they've done in the past? Would we have money left over?
Right now,
I told you.
if everyone got the 25,000, we'd be about
No, but they
200.
wouldn't.
But, oh, well, I mean, I just did like a quick average of,
675,000.
yeah. If the average score was like a 93, then that would be about 640,000.
Okay, so that'd be 35,000 extra.
But I would point out that the scores are getting better every year.
Every year,
They are
mhm.
improving their
And-
applications. They are. The top
Even
scores
from last year?
their scores
Yes.
are, am I wrong?
No, they are.
They are all improving their scores.
I think the other challenge, though, is getting up to that 675. That would require an additional investment of about $300,000 over what was allocated in 2018, which would be, at least from a budget perspective, would be a pretty steep
Yeah,
jump.
increase. Mhm.
And your point?
That is a council decision, so I can't, I'm just making aware of what that
Yeah.
increase would be if we did that.
If we had level funding from last year, the 229,000 would be contracted services, so it would go away. So we would really only be looking at 488,000.
488,
Yeah.
okay. So that's
Yeah.
what we had last year.
Yeah. Okay.
So what they're saying is that
Good.
even if we go to level it to 25,000, we would, if everybody had 100%, we would still have to figure out a way of disappearing money because we don't have that money in our budget, right?
Right, and that would fund at 25,000, about 19 agencies, as opposed to the 27 that are currently funded. So it's still a significant amount of people would
Which
not be
is,
funded.
you know, and I've told you this before, that's fine. We don't have to do this, but we're going to unstick those people that are stuck and make it more fair for that someone just off the street can't come in and say, I want 50, and they get 50, and you cut these people over here. I don't think that's fair. And that happened. And so I think that needs to be leveled out. So those are the two, however we can do that. And this is the only thing we could come up with.
Interesting meeting.
Yeah, you and me. I know. It'd be a whole lot easier if there was 10 people sitting here.
Absolutely.
Because I guess it goes to committee, so we could figure out something before we go back to council, so it kind of,
This
How
is
the
committee.
This is,
no, I
yeah.
know, that's why it goes to committee.
Yeah, you guys, the
Because I was-
timing for your recommendation has traditionally been January. So you have,
We have some more time, so we could have another meeting that all three of us are here.
I have a suggestion, if I may. How about we do the 25,000 for everybody, but then not allow any agency to receive a reduction of more than $10,000.
That's a lot.
Well, that would essentially.
Why would you have a reduction?
That would
address
not-
your issue with Shawnee County.
That would help with, it's trying to come to a compromise here.
Oh, you mean, okay, got it. I thought you meant for next year. Okay, no.
So then that would leave the organization
got it.
that would help access,
They would
leaving
get,
it,
instead of 53, they would be looking at 43 that they could apply for.
Oh, I get it.
but we're saying that the maximum is 25.
25
Except-
for everybody, except no agency can receive more than a $10,000 cut.
It's a good compromise.
And
That would also help the other two agencies, not just this one, that are in the same situation.
and no funding of new programs unless there's
Right.
Correct. Keep that
extra.
others.
Okay.
Yes.
That's my motion.
Say that again.
I'm writing it because I forgot it already.
A maximum allocation of $25,000 with no more than a $10,000 reduction.
Right, so $25,000 cap, except no agency that's currently funded could receive more than a $10,000 cut.
Yes.
Okay, so I make a motion that we set a cap of applying for 25,000 max per program. New programs could be applied for and will be funded if there's money available. And no agency will have a cut of $10,000, period.
And then put your contracted service.
And the contracted services, Safe Streets, Center for Safety and Empowerment, KCSL would move to TPD. HCCI would move to Neighborhood Relations. JAA would move to the grant process. All those in favor, raise your hand.
You're calling the vote, and I would feel ready to
Calling the
vote.
Could I ask a question about subsequent years? I mean, would
Oh.
that mean that every year we would, I mean, if that guideline is followed, we would just expect $10,000 reduction every year?
That wasn't my intention.
I think we just want to get through.
No, I think that it's something that if we can,
Because then it's
if we can
even.
keep the same process
Right.
for the next year, which is unlikely, then we could, yeah.
Maybe the clarification is no more than a $10,000 cut from
Say
the
18 to
approved
19.
2018 funding.
To 19.
Right.
But just what Corey said, keep in mind that when this committee changes, we're typically doing.
Well, hopefully you'll get a, I mean, it's been approved upon. Hopefully you'll get somewhere where you can just stay there.
Hopefully.
We hope.
Yeah, I do too.
They hope too, I'm sure.
If not, if you don't approve, we're going to have to meet again and just start from square one, then, I guess. No pressure, but all those against?
I just feel like this is such a critical thing for us to discuss, and I feel like maybe us three together could have more discussion about this. And I know that it would mean that we would have to meet again, but again, it's not something that any of us take lightly. Because, I mean, these are dollars that are going to our residents.
No, but at some point, we're going to have to compromise. Because
Yes.
what you want, what I want, and Tony wants is going to be different. We're going to have to compromise. So what I don't want to happen, I said this in the last meeting, I don't want us to get to January and go, don't know, I want something done. Like I said, to get them unstuck and level the playing field a little bit. So do you want to just have another meeting then?
Yes.
Okay.
Okay, I think procedurally you have to do
I have to say
something.
no. Yeah, exactly. I have to vote no.
Okay.
And
so-
we're in a
So
tie.
it's a tied vote.
So then we will set another meeting, and we were not going to hold it, Elizabeth, unless everybody can come. Somebody's not going to be here, we're not going to hold it. Then we don't get anywhere, right? Okay. So, do you want to set that now? Or you want to
I'm
just...
going to coordinate with
So I'd
Councilmember
really like it
Henderson.
within the next, before Thanksgiving. Because then after that, I mean, we were kind of running out of time.
No, absolutely.
Okay. Anything else before the committee? What else is on our set date for next meeting? Okay, well, we kind of did that. You'll take care of that, Elizabeth. Ann, any other items before the committee? Going? Okay. Meeting's adjourned. Thank you for coming.
All those meetings we had, I couldn't come up with that, then on the fly, I come up with
It's like
them.
ding.